All right, we're here today with Tony, and Tony's about to start his treatment with Dr. Davis. So, Tony, let's talk about that knee. You've had the right knee replaced.
Yes.
And now the left knee's causing you problems.
Yes. It's gradually gotten worse and worse.
Okay, and how long have you been dealing with that pain?
Over a year.
Wow. Okay. Have you seen any other doctors?
Yes.
And what did they tell you?
Knee replacement.
And you don't want to do that
No.
again? No. All right. So we were talking about the discomfort level, and you said you're at about a 5 today. Is that a typical day for you, or is it a good day, a bad day?
It's typical. If I walk long periods, it's worse.
Okay, so the more that you're on it, the worse that it gets.
Yes.
And you're also experiencing low back pain too.
Yes.
So they kind of go together?
They go together with that and with pains all up and down my leg, into my foot, my thighs.
So it's not just your knee, it's that whole leg.
No.
Okay. All right. So we got some goals that we want to get you back into, and one of them is going to be just walking long distance without any pain. And you also got a new grandbaby, huh? You want to get down on the floor and play with that grandbaby.
Pushing that buggy.
Pushing that buggy. I hear you. All right. So I'm going to have you do a couple different exercises for me, and if you could just pay attention as to where you're feeling the pain, okay?
Yeah.
All right. I'm going to have you stand up for me. Any discomfort when you did that?
Yep. In here.
So you're feeling it above and below that knee. Any pain in the knee itself?
Yes. Right in the center.
Right in the center. Okay. All right. So I'm going to have you put your feet shoulder length apart, arms straight out in front of you, keeping your heels on the ground, squat down as low as you can. Well, that's good. Okay. And slowly come back up. Now, where did you feel that?
My knee, my thigh.
That whole leg. Yep. Okay. All right. So, Tony, I'm going to have you go up and down the stairs now. And I do want you to be aware that there is a hand railing there that you can go up and down the stairs. Yep.
That hurts.
I can see it in your face. Yeah.
That hurts.
So, it's pretty much when it's bending
Yep.
is when you're feeling it?
In the front.
Okay. All right. Let's go up the stairs. Okay.
Hurts, but not as bad as going down.
So down the stairs was the worst for you, and it was when that knee was bending and you were transitioning from one step to the other.
Right.
Perfect. All right, Tony, you ready to get started?
Yes.
Let's do it.
Down. Nice deep breath and pull up. 1, 2, 3, 4, 5, 6, 7. All the way down to the floor. Good. Can you just put your fingers on top of that? Okay, nice deep breath. And up. 1, 2, 3, 4, 5, 6, 7. Reach down. 2 more in this spot. Nice deep breath. And up. 1, 2, up. 3, 4, 5, 6, 7. Down. Nice deep breath. And up. 1, 2, 3, 4, 5, 6, 7. Down. Last one. We're going to do one more. Deep breath and up. 1, 2, 3, 4, 5, 6, 7. Down to the floor. Good. You gained about 6 inches on that. Good.
All right, Tony, I'm going to have you walk all the way down the hallway there.
Yes, I remember that with slots.
You notice any difference? What notices do you notice? What differences do you notice?
My whole posture is different.
Cool. Sorry about that.
Oh, okay.
Oh my gosh. You're walking straighter. You're moving a lot faster.
It just went down.
Look at that smile.
Today, I think
I love
this
it.
one's all swelled up today, and this one is just from sitting.
What'd you notice?
Sat,
Much better.
Awesome.
I don't really care. But
What's your pain level?
up, I mean, it's
2.
2? All right. All right, we're here with Tony. Tony just finished his non-surgical operation with Dr. Davis. Tony, how you feeling?
Good.
Awesome. We're going to do those movements that you did with Becky Let's see where you're at. So I'm gonna have you stand up. How did that feel?
Good.
Awesome. Were you having issues before with that, standing?
Yeah, it hurt all over my leg.
And now?
Just a little bit in the knee.
All right. So you started off with what level of pain?
Today I was 5 to 7.
And you dropped all the way down to a 2, you told me in the hallway?
Yeah.
That's amazing. All right, one step forward. Let's do feet shoulder width apart. Hands out in front of you. Let's try that squat. How low can you go? Oh my gosh. Get back up. Did you just want to stay down there? How'd that feel?
Okay.
Any difference from the last time?
Yeah, there's a lot less pain in the leg.
Fantastic. Let's try these stairs. Come down the stairs. Which one was worse before, down or up?
Down.
Down.
Much better.
You just flew down those stairs. Oh. Are you showing off?
I just haven't done that in a while.
Oh, that's so great. Oh, what are you going to start doing again that you haven't been doing?
Running.
Oh, I love it. All right. So this is great news. Are you going to keep coming back?
Yes.
All right. And we haven't even done the other therapies. All right.
Okay.
I'm so excited.